My name is Colonel Jason Condry. I'm the commander of U.S. Army Garrison Stuttgart, and I wanted to take a few minutes to give you an update on a very pressing topic, COVID-19. I know there's a lot of concern out there, and I want to do my best to explain not only what's happening within the community, but how we're linked in with our partners outside. So I will tell you that the recent directives this weekend that stopped military travel for those military and civilian members going into or out of Italy and Korea has created some questions. I want to let you know how we're postured to protect and mitigate this community, and should there be a case within this community, how we're prepared to respond. So first, I think it's important to start with what I know as of today, this evening. So first, there are no members of this joint military community that have tested positive for COVID-19. And as we look outside into Stuttgart and really the state of Baden-Württemberg, as of this evening, there were 234 reported cases, positive cases of COVID-19. I anticipate by the time you see this video, that number will have gone up slightly. I think it's important to understand that there is constant review of the conditions and the circumstances and guidance within our German partners that is coming from the federal level down to the state, and then of course to the city of Stuttgart and the cities where the bulk of our community lives. Specifically, I want to highlight one piece. The Federal Minister of Health put out today that across Germany, leaders should consider canceling events that have more than 1,000 attendees. He was quick to say that that is not a recommendation to close schools, kindergartens, or daycares nationwide. Within the state of Baden-Württemberg, that has generated a change or an element of guidance to where local officials are looking at the closure and cancellation of public events where there are large crowds gathering. And so what we are seeing specifically is that if there is a positive test of COVID, then a school will close. If there are some community events that don't have to be conducted, then they have looked to cancel some of those. The only directives we've seen thus far relate to students that have been skiing in northern Italy in the last 14 days. They've asked them not to come to school, to self-isolate for 2 weeks to ensure they don't spread the virus any further. So in all, there's no directive guidance. What they're asking is for local officials and event organizers to look at, assess the risk, and implement mitigation, and then make a decision based upon that information. Our Stuttgart International Airport has normal operations. They've implemented some additional screening, but otherwise that and some hand washing stations, all things are normal at the airport. What we're seeing across the board outside of our installation is local leaders making local decisions based upon local considerations. The next thing I'd like to talk about is how we protect and mitigate against the spread of this virus. So there's 3 pieces to that. There's individual actions, the things I'm asking you to help with. There are things that units and organizations across the installation are doing, and the things that the garrison is doing to support both you and those units across the installation. I'll start with the things that I need your assistance with. First of all, I need you to understand how this virus is transmitted, because I need you to wash hands. I need you to cough into your sleeve. I need, if you for one moment feel like you are ill or sick, to take yourself out of the workplace, take yourself out of school, go home, and get some advice from a doctor as to how you should proceed. So I want to dig into self-isolation a little bit more, because there are a couple members of our community that have, because of contact with positive cases, are self-isolating. And I'm asking you to do an assessment. Are you prepared to self-isolate? And I'm not saying that because I'm trying to generate a run on the commissary and make the shelves bare where there once was ramen and Spam. The reality is I want you to have a conversation inside your home, have a conversation with your coworkers, have a conversation with your neighbors, because in cases of self-isolation, we're going to be dependent upon those around us to ensure the things that we didn't anticipate, and there will be things you don't anticipate, there's somebody positioned to assist with. Units across the installation have already been thinking about this problem and planning for how it might impact their day-to-day operations and their missions into the future. They've implemented some fairly simple measures. In some cases, they're not traveling as much as they used to, focusing on mission essential only. In other cases, they've gone to meetings that would be in person to virtual, and where you can't do that, just adding another chair in between everybody so you've got that 3 foot of personal separation. The other thing I've asked them to do is refine some of the reporting requirements. It's important that we understand who is self-isolating, who may potentially be infected or have come in contact with somebody that's infected with COVID-19. I've also asked them to implement cleaning teams so that if there is somebody within our operational facilities that tests positive, that we have a method in place to clean the environment to ensure that that isn't the reason why somebody else tests positive or gets infected. And the last thing I've asked them to do is take a hard look at how they may support single service members, families, those individuals that they deem necessary to isolate and deal with all those concerns that may pop up. For the Garrison, I want you to know that as I look at all the things that the Garrison does for you and the units across this organization, I'm thinking about that from the point you enter the installation, through the schools, the CDCs, the fitness facilities, the food courts, commissaries, shopettes, pretty much anywhere where you as a community come together and we see you often, daily. So we're focused on those areas. The first thing I've done is ensure that the staff is as informed as possible. Every day we're sending out an update because I want them to be able to answer a question that you might have. And if they don't have the answer, to be able to direct you to a resource out there. The next piece is our integration into our local partners. 78% of our community lives off the installation. And so I want to know what local officials are saying and making changes that affect you where you live. So the Garrison will continue to pace itself based upon the guidance we get from our higher headquarters. Of course, informed by guidance from the CDC, informed by German health officials, the Robert Koch Institute, and of course what we are seeing in the communities that you live in. I will tell you that as those things change, we will keep you informed using StuttgartCitizen.com, our Facebook page, and of course the app, which links you to both those. So I want to talk about some of the measures that we've already got in place. You should already be seeing some increased cleaning and sanitation at all of our facilities. Similarly, all of our employees are focused on the health of their coworkers as well as kids, if we're talking about schools or we're talking about child care centers. Also, we have identified facilities here on the installation that we are prepared to house any family that needs to be isolated or single service member. That includes the delivery of furniture, appliances, pots, pans, dishes, linens, all the things that you would need to be able to self-isolate for up to 14 days. So I know a lot of the members of the community are concerned about, should I have family visit? Am I going to be able to go on spring break? Right now, unless you're headed to Korea or Italy, there shouldn't be any impacts to your plans. The CDC threat level for Germany doesn't require that. Should that change, I realize that will have implications, and the reality is those will be different for every family, for every individual. And so we will create a venue that allows us to understand what those individual implications are, and if there are limitations, figure out how we may find a way to support your specific concerns, your specific requirements, and answer your specific questions. There are lots of discussions ongoing about community events. I will tell you that we are constantly reviewing every event that we have on the schedule. We want to make sure that the mitigation that we have in place is correct and matches the conditions that we're seeing both within the community and outside. Cancellation of an event potentially affects the entire community. I'm aware of that and want to be very deliberate in making those decisions. We've only had one canceled thus far. The Baby Expo we had scheduled for the end of the month is now being pushed to a later date. That's not because of the risk of infection, though that was a consideration. The reality is the neonatal medical providers that were coming from out in our local community to talk to our expecting mothers and fathers were not able to come based upon hospital guidance. I realize that despite the best measures we put in place, the fact that someone can unknowingly spread the virus is still a concern. Admittedly, I depend on individuals to help address that. The same concern persists whether we're talking about being at work, whether you're in the commissary, or just in one of our community areas. And so with that in mind, and presuming the current guidance from my higher headquarters and the current health guidance remains the same, my intention is to leave community events scheduled and let community members choose whether or not they want to attend. There's lots of concerns about the Spring Bazaar. So the vendors that are coming to our Spring Bazaar are currently in Rhineland Falls. They were there for this last weekend for their bazaar. They're not scheduled to arrive here until Tuesday evening. On Tuesday, I'll make a decision based upon the current conditions and determine whether or not they should make the trip. So I want to talk about what will happen should we have a positive test for COVID-19 within the community. As I said, we've been integrated in the planning with units across the installation. We've designated with our public health emergency officer a team designated to trace where a positive tested individual who he's had contact with, where they may have been, what they've done. And so we understand the true scale and the impact on the garrison, on the workplace. We will then ask units to implement their cleaning efforts to make sure that we've done all the things necessary to minimize the transmission of that virus from the place of work and the areas that that individual went. Even with what I've just laid out in terms of our response, individual actions are still the best defense against a positive test result within the community. Your actions are going to matter the most. If you're ill, go home. If you're not ill, wash your hands. Perhaps stand a little bit further apart from other people in public spaces in the checkout line. Perhaps even minimize the amount of time you spend in some of the public areas. So I understand that the situation is very dynamic, and the reality is overnight things change. At least once a week, we will continue to engage and create the opportunity for you to engage. So the town hall that we did last Thursday will become a recurring event. Every Thursday from 1830 to 1900 via Facebook, you'll be able to ask us questions, and we will be able to give you some updates on what's happening within the community and outside of our community, things that I think may be impacting you and your families. I appreciate your time and attention. I realize that for this, there's no playbook. I know most days there's more questions than there are answers. It's going to take a team, individuals, units across the installation and the garrison all coming together in order to deal with COVID-19. Thanks, and I look forward to your questions and comments.